Have you ever bought basil seeds simply because someone told you they help with weight loss, improve digestion, control blood sugar, or completely transform your body if you drink them every morning? If your answer is yes, then the next few minutes are especially important for you. There is an important truth about basil seeds that most social media videos never mention. Because of this, thousands of people consume them every day without getting the benefits they expect. In some cases, people unknowingly make mistakes that can turn a healthy habit into a health concern. Imagine this situation. It is summertime and someone decides to lose weight. After watching a few videos online, they buy basil seeds and begin drinking a large glass every morning. 1 week passes, then 2 weeks, and eventually a whole month. Yet their weight barely changes and they never experience the increased energy or health improvements they were promised. Why does this happen? Are basil seeds really not as beneficial as people claim? Or is the real problem something else? That question is the focus of today's discussion. The answer is not simply yes or no. The biggest mistake isn't buying basil seeds, it's using them incorrectly. Unfortunately, this is something most people never learn. Here's another interesting fact. If I asked you the difference between basil seeds and chia seeds, many people would probably say they are exactly the same. Surprisingly, this is one of the biggest misconceptions. Although they look very similar, both expand in water and both are considered healthy foods, they are not the same. Failing to understand this basic difference often leads to many other misunderstandings. Before we discuss that difference, however, we first need to understand something even more important. Why have basil seeds suddenly become so popular? Over the past few years, almost every health content creator has made videos about them. Some claim they are excellent for weight loss, others say they detoxify the body. Some even claim they can cure diabetes, while others present them as a miracle superfood. Whenever you hear extraordinary health claims, it becomes even more important to examine the scientific evidence carefully. Just because something is repeated over and over again on social media does not automatically make it true. Let me make one thing very clear. The purpose of this discussion is not to scare you away from basil seeds or suggest that they are harmful. When consumed correctly, in appropriate amounts, and by the right person, they can certainly become part of a healthy diet. However, if they are used incorrectly or without considering your medical conditions, medications, or personal nutritional needs, the same food can create unnecessary problems. That is the difference between responsible health education and oversimplified advice commonly found online. Today we'll explain exactly what basil seeds are, how they work inside the body, the 7 most common mistakes people make while using them, who should be especially cautious, and finally, an easy daily routine that allows you to use them safely and effectively. Before we begin, ask yourself one simple question. Do you eat basil seeds because someone recommended them or because you actually understand what they do inside your body? By the end of this discussion, your answer may completely change. Let's begin with the basics. What exactly are basil seeds? Surprisingly, many people consume them regularly without knowing what they actually are. If you visit a grocery store or herbal shop and ask for basil seeds, you'll usually receive tiny black seeds that closely resemble chia seeds. Because of their similar appearance, many people assume they are identical. In reality, they come from completely different plants. Basil seeds are obtained from sweet basil, while chia seeds come from an entirely different species. Although both contain beneficial nutrients, they differ in structure, nutritional composition, and the speed at which they absorb water. Understanding this distinction is important because many people read research about chia seeds and automatically assume the same findings apply to basil seeds. In reality, scientific studies often evaluate them separately, and not every benefit associated with chia seeds has been proven for basil seeds. This misunderstanding is one of the reasons misinformation spreads so quickly online. Now comes the next important question. What actually happens after basil seeds enter your body? Imagine placing 1 teaspoon of basil seeds into a glass of water. Within minutes, each seed becomes surrounded by a transparent gel-like coating. This isn't magic. It happens because basil seeds contain soluble fiber, which absorbs water and forms a soft gel. The same process continues inside your digestive system. As the fiber reaches your stomach, digestion slows slightly. Because food remains in the stomach longer, many people feel full for a longer period, making them less likely to snack frequently. However, here's an important misconception that needs to be corrected immediately. Feeling full does not automatically mean you will lose weight. If weight loss were that simple, everyone would achieve it effortlessly. Body weight depends on many different factors, including daily calorie intake, physical activity, hormone balance, sleep quality, stress levels, and the overall quality of your diet. Basil seeds can support a healthy lifestyle, but they cannot replace healthy eating habits or regular exercise. This raises another important question. If basil seeds are truly so beneficial, why doesn't every doctor recommend them to every patient? The answer is simple. Nutrition is never one size fits all. The same food can affect different people in completely different ways. For example, imagine two individuals eating exactly the same amount of basil seeds. One is young, healthy, and physically active. The other has diabetes, takes blood pressure medication, or suffers from chronic digestive problems. Their bodies will not respond in the same way. That is why responsible healthcare professionals never evaluate a food based only on whether it is healthy. They also consider who is eating it, what medications they are taking, and what health conditions they already have. Unfortunately, this is exactly what many people overlook. Many people start using Sabja seeds after hearing claims that they can help with weight loss, improve digestion, control blood sugar, detoxify the body, or completely transform health. Social media is filled with impressive success stories, making these tiny black seeds seem like a miracle food. However, the reality is much more balanced. Sabja seeds can certainly be a healthy addition to a balanced diet, but they are not magic. The biggest mistake people make is believing that simply adding Sabja seeds to their daily routine will automatically solve problems like obesity, diabetes, or poor digestion without changing any other lifestyle habits. Health improvements always come from a combination of balanced nutrition, regular physical activity, quality sleep, stress management, and consistency. Sabja seeds contribute mainly because they are rich in soluble fiber, which absorbs water and forms a gel-like coating. This slows digestion, helps some people feel full for longer, and may support digestive health. However, these benefits vary from person to person and should never be exaggerated into unrealistic promises. Another common misunderstanding is confusing Sabja seeds with chia seeds. Although they look similar and both expand in water, they come from different plants and have different nutritional characteristics. Many online articles and videos mix research about chia seeds with Sabja seeds, leading to misinformation. Understanding this difference is important before expecting specific health benefits. Using Sabja seeds correctly is just as important as choosing to eat them. One of the most serious mistakes is swallowing them dry. Since these seeds rapidly absorb water and expand several times their original size, they should always be soaked in clean water for about 15 to 20 minutes before consumption. Once soaked, they develop a soft gelatinous coating that makes them much safer and easier to digest. Dry seeds may present a choking risk, especially for children, elderly individuals, or anyone with swallowing difficulties. Another frequent mistake is assuming that more is always better. Some people begin consuming 3 or 4 tablespoons every day, expecting faster results. Because Sabja seeds contain large amounts of fiber, suddenly eating excessive quantities may lead to bloating, stomach discomfort, gas, constipation, or even diarrhea, particularly in people whose digestive systems are not accustomed to high-fiber foods. Nutrition experts generally recommend starting with 1 or 2 teaspoons and gradually observing how the body responds. Adequate water intake is equally essential. Fiber functions best when enough fluids are available. Without sufficient hydration, digestive discomfort may actually increase instead of improve. People with medical conditions such as kidney disease or heart failure should never increase water intake without medical advice. It is also important to remember that no single food can replace a nutritious diet. Sabja seeds work best when combined with fruits, vegetables, lean proteins, whole grains, and healthy lifestyle habits rather than serving as the centerpiece of a health plan. Another essential lesson is that healthy foods are not automatically suitable for everyone. Individual medical conditions, medications, age, and nutritional needs must always be considered before adding any new food regularly. For people living with diabetes, the soluble fiber in Sabja seeds may help slow the rise in blood sugar after meals. While this can be beneficial, those taking diabetes medications or insulin should monitor their blood sugar carefully when introducing Sabja seeds because blood glucose responses can differ between individuals. Similarly, people taking medications for high blood pressure, blood thinners, or other chronic conditions should discuss dietary changes with their healthcare provider. Children, older adults, pregnant women, breastfeeding mothers, and individuals with swallowing disorders or digestive diseases also require extra caution before making Sabja seeds a daily habit. One person's positive experience should never be treated as universal medical advice because every body responds differently. Perhaps the biggest mistake is treating Sabja seeds as a miracle cure capable of replacing exercise, balanced eating, quality sleep, or prescribed treatment. Sustainable health is built through small, consistent habits practiced over months and years rather than quick fixes promoted on social media. When used properly, Sabja seeds can become one useful part of a healthy diet, but they should always be viewed as a supportive food rather than a magical solution for every health problem. Using Sabja seeds correctly is far more important than simply adding them to your daily diet. Many people hear about their health benefits on social media and immediately begin consuming them without understanding the proper method of preparation or the correct quantity. This often leads to disappointment or unnecessary digestive problems. The first and most important rule is that sabja seeds should never be eaten dry. These tiny seeds have an extraordinary ability to absorb water and expand several times their original size. When they are soaked, they develop a soft, transparent, gel-like coating around each seed. This process not only makes them easier to digest, but also significantly reduces the risk of choking. Consuming dry sabja seeds may become dangerous, especially for young children, older adults, or people who have difficulty swallowing. Because the seeds continue expanding after coming into contact with liquid, swallowing them without soaking can create discomfort and in rare situations even become a choking hazard. This is why nutrition experts recommend soaking them in clean drinking water for at least 15 to 20 minutes before consuming them. Once the seeds have fully expanded and formed their gelatinous coating, they become much safer and more pleasant to eat. Another common mistake involves consuming excessive quantities. Many people mistakenly believe that if 1 teaspoon provides benefits, then 3 or 4 tablespoons must provide even greater results. Nutrition rarely works this way. Sabja seeds are naturally rich in soluble fiber, and while fiber is extremely beneficial for digestive health, too much fiber introduced suddenly can overwhelm the digestive system. Individuals who are not accustomed to eating high-fiber foods may experience bloating, stomach cramps, excessive gas, constipation, or even loose stools after consuming large amounts. The digestive system needs time to adjust whenever fiber intake increases. Beginning with 1 or 2 teaspoons each day allows the body to adapt gradually while reducing the likelihood of unpleasant side effects. As the digestive system becomes more comfortable, some individuals may continue using the same amount regularly without any issues. Consistency is far more valuable than consuming large amounts in hopes of achieving faster health improvements. Small, sustainable habits usually produce better long-term outcomes than extreme dietary changes. Hydration is another critical factor that many people overlook. Fiber functions most effectively when sufficient water is available throughout the digestive system. Since sabja seeds absorb large amounts of liquid, they require adequate hydration to move smoothly through the intestines. Drinking too little water while increasing fiber intake may actually worsen constipation instead of relieving it. Some people mistakenly assume that soaking the seeds alone provides enough fluid, but maintaining proper hydration during the entire day is equally important. Adequate water supports healthy digestion, improves bowel movements, and allows soluble fiber to perform its intended function efficiently. However, hydration recommendations should always be individualized. People with kidney disease, congestive heart failure, or other medical conditions that require fluid restriction should never increase their water intake without consulting their physician. Personalized medical advice should always take priority over general nutrition recommendations. Another important consideration is understanding that healthy foods do not affect every individual in exactly the same way. Every person's metabolism, medical history, digestive system, medications, and nutritional requirements are unique. Someone who experiences noticeable digestive improvements after introducing sabja seeds may naturally recommend them to friends and family. While their positive experience is genuine, it does not automatically mean everyone else will respond similarly. Nutrition is highly individualized. Age, activity level, existing health conditions, genetics, and overall dietary patterns all influence how the body reacts to any food. Treating someone else's experience as universal advice often leads to unrealistic expectations. Responsible health decisions should always consider personal circumstances instead of following trends blindly. People living with diabetes should also exercise thoughtful caution when adding sabja seeds to their diet. The soluble fiber present in these seeds may slow the digestion and absorption of carbohydrates, which can help moderate the rise in blood glucose levels after meals. Although this effect may be beneficial, individuals taking blood sugar lowering medications or insulin should monitor their glucose carefully during the first several days of regular consumption. Because medications and dietary fiber can work together, blood sugar may occasionally fall lower than expected in certain individuals. Symptoms such as dizziness, sweating, trembling, weakness, confusion, or sudden hunger should never be ignored. These symptoms may indicate low blood sugar and require prompt attention. Any significant dietary change should be discussed with a healthcare provider, so medication adjustments can be made if necessary. People taking medications for high blood pressure, heart disease, or blood thinning should also seek professional medical advice before making sabja seeds a regular part of their diet. Although the seeds themselves are generally considered safe for most healthy adults, chronic medical conditions require individualized nutritional planning. Physicians and registered dietitians evaluate a person's complete medical history, medications, laboratory results, and overall health before recommending dietary modifications. Internet advice cannot replace personalized medical guidance. A recommendation that is appropriate for one individual may not be appropriate for another with different medical needs. Special attention should also be given to children, elderly individuals, pregnant women, breastfeeding mothers, and people with swallowing difficulties or chronic digestive disorders. Children have unique nutritional requirements, and introducing high-fiber foods should always be done appropriately for their age. Older adults who have experienced strokes, neurological disorders, Parkinson's disease, or weakened swallowing muscles may have an increased risk of choking if seeds are not prepared correctly. Similarly, people with inflammatory bowel diseases, severe digestive disorders, or gastrointestinal narrowing should consult healthcare professionals before increasing their fiber intake. Pregnancy and breastfeeding involve unique nutritional demands that require individualized guidance rather than generalized internet recommendations. Perhaps the greatest misunderstanding surrounding Sabja seeds is believing they are a miracle solution capable of replacing healthy lifestyle habits. Many people begin drinking Sabja seed water while continuing to consume excessive sugar, processed foods, and unhealthy snacks, expecting dramatic weight loss or complete control of chronic diseases. When the expected transformation fails to occur, they become disappointed and assume the seeds do not work. The truth is that no single food, supplement, fruit, herb, or seed can independently create lasting health. Real improvement comes from combining balanced nutrition, adequate protein intake, regular physical activity, quality sleep, proper hydration, stress management, routine medical checkups, and consistency over time. Sabja seeds may contribute positively as one component of this larger picture, but they should never be viewed as a replacement for comprehensive healthy living. Sustainable health is built through small daily choices repeated consistently over months and years rather than relying on any single trending superfood. In conclusion, Sabja seeds can be a valuable addition to a healthy diet, but only when they are used with the right knowledge and realistic expectations. They are not a miracle cure for weight loss, diabetes, digestive problems, or any other health condition. Instead, they offer potential benefits because of their fiber content and nutritional value, especially when they are properly soaked, consumed in moderate amounts, and combined with adequate hydration and a balanced lifestyle. Understanding the difference between Sabja seeds and chia seeds, avoiding common mistakes, and recognizing that every person's body responds differently are essential steps toward making informed health decisions. It is equally important to remember that age, medical conditions, medications, and individual nutritional needs should always be considered before introducing any new food into your daily routine. The healthiest approach is never to follow internet trends blindly, but to rely on evidence-based information and professional medical advice whenever necessary. True health is never built by one food, one supplement, or one shortcut. It is the result of small, consistent habits practiced every single day. Eating a balanced diet, staying physically active, drinking enough water, getting quality sleep, managing stress, and following your healthcare provider's recommendations. Sabja seeds can certainly play a supportive role in that journey, but they should always be viewed as one piece of the bigger picture rather than the entire solution. When you focus on long-term healthy habits instead of quick fixes, you create lasting results that benefit your body for years to come. If you found this information helpful, don't forget to like this video, share it with your family and friends, and subscribe to the channel for more evidence-based health and nutrition content. Until next time, stay informed, stay healthy, and take good care of yourself.